Hi, my name is Jim Stratoudakis. Professionally, I'm a licensed clinical psychologist. I've provided direct clinical services. I've been in program management, supervision, and executive management of public mental health systems. I also have been faculty at George Washington University Medical School and George Mason University Counseling Program. I've since retired and now living in Fairfax, Virginia, and I've connected with the Virginian Outpatient Physical Therapy Department to help me put together a good treatment plan for my Parkinson's disease, which I was diagnosed with in 2014. After I was diagnosed with Parkinson's disease, I began to do a lot of research. And earlier this year, I came across TheraCycle and reading a Ready Steady Boxing newsletter that is worldwide about persons with Parkinson's disease and activities that help manage and control symptoms. When I looked up the TheraCycle, I called the manufacturer in Boston, said, here's where I live. Do they sell these machines to people individually? The answer was yes. And also they sent me an article. That's how I found out about Shirlea Hennessy and the Virginian Outpatient Rehab Center. Just like with all the other providers you have as part of your treatment team, if you take the TheraCycle, you need to work with someone that knows what they're doing and is aware of the research. At the Virginian Outpatient Rehab Center, there are staff here that are trained to work with the TheraCycle.
I think it is a great adjunct to utilize for those with Parkinson's, especially those with cognitive factors and deficits that make exercise maybe harder, or maybe doing higher intensity exercises may become unsafe to perform. This offers a high intensity exercise wellness program for those clients. There was a lot of research that came out recently with utilizing the TheraCycle, so it's good evidence-based practice that clinicians can use for those with Parkinson's.
What I like about TheraCycle is the way it was designed. It's easy to get on and off. Most exercise bike, whether it's forced therapy, forced exercise or not, are difficult to get on. So this is very easy access to the seat. There are some things that need improvement in terms of how the seat sometimes slips and you slouch. And I've been in touch with Sherry at Virginia Outpatient Rehab, as well as the people that manufacture it, to give them some feedback. And they're very open to that because they want to make sure their product is always improved upon. It helps me relax. There's times when, after a busy day, I feel a little tense. I can hop on the TheraCycle, and it helps get a lot of tension out of my system. And I also do the Cleveland Clinic protocol a minimum of 3 times a week, which is shown to have some positive outcomes in terms of managing symptoms of Parkinson's. I'm still new to the program and will continue to work on it to make sure that I can get the best benefit I can. But as I said earlier, this is a lifelong commitment. It's not something you do for 3 weeks or 3 months or 3 years. You do it for the rest of your life. And with the combined treatment team approach that I mentioned, I hope for myself to have very good outcomes in controlling the symptoms of Parkinson's. Really comprehensive treatment program in place. Again, I would recommend it. Make it part of your treatment plan. And whatever you do, you have to do it every day. And as Winston Churchill said many years ago, never, never, never give up. Always stick to it. There's no excuses. TheraCycle and other interventions have to be part of our daily life, just as we eat, sleep, and drink water. You need to have exercise grounded in research to help manage your symptoms in Parkinson's. And together we will be on a journey to get the best we can for our lives and to help our loved ones. Thank you for the opportunity to let me talk about my experience to date with the TheraCycle. Take care.